Psychosomatic syndrome disorder. So basically it's when someone has physical symptoms of something without actual biological cause for them. Sometimes people create a very significant focus or hyperfixation over physical symptoms, which causes them to have a hard time functioning in their lifestyle. In order for this disorder to actually be diagnosed for someone, they have to show somatic symptoms that cause distress or dysfunction in their lives. The somatic symptoms have to be going for at least 6 months, and also they have to be showing some sort of excessive anxiety or stress or nervousness or even depression. Some causes of this disorder are actually mainly going to be environmental and not so much genetic. They're going to be environmental and also psychological. So basically, people who were sexually or physically abused in their childhood, excessive focus on bodily functions, whether that's swallowing, eating, breathing, just kind of the way your body moves, functions, any kind of hyperfixation on that can cause. The genetic factor that kind of feeds into this is sensitivity to pain. It can be a cause of SSD, however, it's not so much genetic as it is psychological and environmental. SSD doesn't actually have an actual cure for it. They do recommend for treatments having some sort of psychotherapy. Pretty much it's just talk therapy where you're talking to someone. It's just to help find a way to cope with anxiety and nerves and kind of just find a way to live with your another thing is people who have anxiety and depression with SSD, they recommend taking antidepressants and anxiety meds just because it can be beneficial. However, there still is no cure for it. There's a case study done on a 62-year-old male. He had been going and showing up to the emergency room pretty persistently. He didn't really understand what was going on. He said, he explained his pain as numbness of the forehead, of certain body parts, and it was difficult being able to understand what he was feeling just because they weren't really finding anything that was wrong with him. He looked into internet research and he found lead poisoning and symptoms of it, and so it kind of caused him to believe that he possibly had it. He went back to the hospital to get tested for lead poisoning, and all his blood results came back normal, but he did explain that once he started like facing these symptoms, it was right when his daughter left his home. So SSD is also kind of related to having really big changes in your life that cause even more stressors. He did have a past of anxiety and just depression in his lifestyle, so it was kind of something that was almost an effect of it, basically. So any big stressor can also kind of trigger this to cause um, these sort of symptoms to start developing. A couple controversies towards SSD are going to be that people believe it's not real just because it can't be kind of proved. There is no actual physical way of proving that there's something wrong with people or that they have an actual disorder. It's not showing actual like biological reasoning for their pain or for the way they're acting. Um, Another controversy is that many doctors actually misdiagnosed people and just told them that they had anxiety, and they didn't really understand. They didn't really accept having anxiety because they didn't really experience they experienced the nervousness and the stress from it. However, it wasn't exactly like the symptoms of it because they were still experiencing this physical pain. Not being able to find a cure for it was also something that's very controversial towards this topic, just because some people believe that it's not possible to find a cure, and people are just kind of making it up in their heads that they actually have something when they actually don't for attention purposes. Conversion disorder is when a person experiences physical and sensory issues, even though there is no neurological pathology. This disorder tends to cause more serious physical pain, so it'll cause numbness, paralysis, deafness, blindness, and other kind of sorts of neurological effects. A couple causes of the disorder are actually going to be physical pain, physical injury, that anything like extreme that kind of triggered it, or even just neurological triggers in general that kind of impacted it and started it to develop. Things that are recommended in order to treat the actual disorder are going to be counseling. It's pretty much just to figure out what's underlying, what are stressors or anxiety things that are kind of causing you to be affected by conversion disorder. Something to recognize is definitely that this isn't exactly like SSD. It has some similar aspects to it. However, SSD is definitely much more excessive. Um, So conversion disorder actually only experiences just slight depression and anxiety, whereas SSD experiences much more excessive stressors. It affects your time, it affects the way you kind of function, the way you're kind of living your life. In a way, conversion also does. However, it's not as excessive as SSD is. Basically, illness anxiety, in simple terms, it's just stressing over being sick, stressing over having some sort of illness that you don't actually have. It kind of causes you to feel symptoms of that, but it won't really cause anything else. It just kind of causes you to stress about something that just doesn't exist to you.